You've got a lot of options. Welcome back to the New Nurse Guidebook channel. My name is Pierre Lafour, and if you're new to this channel, the purpose of this channel is to help new graduate nurses live healthy, wealthy, more happy and fulfilling lives. I asked one of the student nurses on my floor, what would you like to see a video on? And she said, I'd love to see a video on different jobs available to me when I graduate and work as a nurse. So we're going to split this video into two parts. First part is going to be talking about in-hospital bedside nursing. And the second part is going to be outside hospital or away from bedside nursing. This is a little sneak peek. So, in-hospital bedside nursing. We're going to start off with Med-Surgical. A lot of your nursing professors will say you have to start in Med-Surg. With Med-Surg, you're going to have anywhere from 5 to 6 patients, unless you're in a sketchy hospital and you get like 7 to 8. Yikes. Typically, this is where I like to say you get good. You get good at passing meds to a lot of patients, doing a lot of assessments on a lot of patients, getting exposed to a lot of disease processes. But from my experience, you don't get to really dive deeply into the why and the pathophysiology. You're really treading water and surviving and just doing a lot of things all the time. And you can kind of get spread thin with this many patients. So that's Med-Surg nursing. Next, we're going to jump into critical care. Now, there's a variety of environments and different flavors of critical care, so I'll kind of go through them quickly to give you an overview. We've got ICU. It's a general ICU, broad umbrella that could cover pretty much any of these. Next, we have NICU, or neonatal ICU. This is for your teeny tiny babies that are born premature and are really sick. My aunt works in the NICU and my cousin. So yeah, very sick babies. Then we have the PICU. Pediatric ICU. This can be a broad spectrum of age range, anywhere from 2 to 3 months to 18 years old. And it's kind of crazy if you're the nurse, because you got to be well equipped and well knowledgeable to take care of all of those different patients. Typically, when a patient leaves the NICU, they don't take them back to the NICU and they'll come to the PICU. That's why there's such a broad age spectrum with that. My cousin used to work in the PICU. She said one of the sad things was seeing a lot of sick children patients die. So just keep that in your mind too. CCU, cardiac care unit. This is for people who are pre-surgical cardiac patients, usually in heart failure. They'll be on Lasix strips, they'll be on dopamine drips, dobutamine drips, just things to help their heart beat and keep going until they need to go into surgery. You'll be finding your balloon pumps and your Impellas and patients who are getting ready for LVAD placements, all that fun stuff. And you're basically just kind of keeping them alive till they can go to surgery to fix their heart. Cardiovascular intensive care unit. This is my baby, my home floor. With the CVICU, you're getting people after their hearts have been repaired. I don't know, I did a broken motion, repaired. So this will be your valve replacements, bypass surgery, all that fun stuff. Neuro ICU. Some people call this might sound terrible, but the vegetable garden. Typically, it's patients who've had strokes or brain traumas, and typically they're paralyzed and intubated and sedated, and you're monitoring their intracranial pressures and all that stuff. That's the neuro ICU. My friend Terry works in the neuro ICU. Trauma ICU. This is where you're seeing a lot of your crazy stuff, like your motor vehicle accidents, your motorcycle wrecks, explosions, different things like that. It's all the crazy stuff, but they're relatively stable by the time they get to in the trauma ICU, usually. Emergency department ICU. I've heard of some hospitals doing this. The hospital I went to nursing school at, Augusta University, they had an ER ICU. It's basically like an intermediate care level. Like, we don't have enough beds remaining in the rest of the hospital right now, but this patient's really sick, and so we need to have them, intubated and sedated and on propofol, which helps keep them asleep and comfortable. We have them on vasopressors, which are medicines that help keep your blood pressure up, or we have them on medications that help bring their blood pressure down. Medical ICU. This, I'd say, I like to call this like ER++. This is where a lot of your patients who are in the ER are too sick to stay in the ER and they don't have an ER ICU. They'll send them to the MICU, or the medical ICU. You're going to look at patients with diabetic ketoacidosis, alcohol withdrawals, sepsis is another huge one, acute respiratory distress syndrome, where their lungs are just going bad. Those can be very depressing patients. Surgical ICU. So this is a more broad-based surgical environment. So you can have a variety of different surgical patients. Instead of it being super focused and specialized like CVICU, you could have one person who got an appendectomy and they were really sick, their appendix out. Or you could have somebody with big belly and their bowel had a resection. Or you could have somebody who had their thyroid removed. There's a big variety of different things you can see in the surgical ICU. Burn ICU, very specialized, takes a very special kind of person to handle the burn ICU. Burns don't discriminate against age, gender, race. Anybody can get burned. Anything's fair game. It's pretty intense, very specialized, but very interesting. Typically in the ICU, you'll have 1 to 2 patients. I've heard of some hospitals having 3 patients and like hallway patients. That's kind of sketchy. I wouldn't want to work in a facility like that and put my license and my patients at risk. So yeah, moving right along, we've got the emergency department. Typically in the emergency department, you'll have 2 to 5 patients. I did my practicum in the emergency department. Get used to doing a lot of line and labs when you're triaging and 12 lead EKGs. Line and labs means you're putting in an IV in their arm and pulling blood out of it to do labs. And then 12 lead EKG is putting stickers on them to see their heart rhythm to rule out a heart attack. Emergency department is the spice of life. A lot of variety, a lot of action, but it can get tiring. In California, I know they have regulations in place where depending on how sick your patient is will affect your patient ratio. So if you have like an intubated, sedated patient, it might be a 1-to-1 or a 1-to-2. So that's really cool. Thank you, California. Operating room. Typically, as an OR nurse, you're going to have 1 patient. And your job, from my understanding, is you're doing a lot of charting and you're counting instruments and you're helping the surgeon with anything in the process. You really don't, from my understanding, get to do hands-on skills a lot of the time, like starting IVs and things like that. It's a very nice work-life balance as far as your shift goes. Typically, this will be an 8-hour shift from 7 a.m. to 3 p.m. But operating room nurse is still pretty cool. You're kind of in the heat of it, getting to see surgery and all that fun stuff. OBGYN, moms and babies. So this can be the delivery process of the mom where they're vaginally delivering the baby or getting a C-section in the surgical theater. And then the mother-baby portion of it. Okay, mom and baby's been born. Let's take care of them after the fact. And also leading up to when the mom delivers the baby. Very interesting, not my cup of tea personally, partially because I'm a dude, but OBGYN, that's what you have to expect with that. I don't know what the patient ratios are. I would imagine it's like 2 to 3 patients unless they're like about to deliver. It'd be interesting to interview an OBGYN nurse and pick their brain on that. Pediatrics. Pediatrics is kind of that's a broad spectrum of pediatrics. We mentioned the pediatric ICU right here, but pediatrics will typically entail like a pediatric med-surg floor, pretty broad spectrum. You can have even specialized like pediatric oncology, and you'll have 5 to 6 patients. Another big thing to take into consideration with pediatric patients is you're not just taking care of them, you're taking care of their parents and the family. So there's a bigger picture with that. There's different levels of social communication. When I cross-trained in the PICU, I would sit down with my parents and be like, here are the medications I'll be giving them, and go through all of them and tell them. And here's what I'm going to do. If you ever see anything or need anything, let me know how I can best take care of your child. And there's definitely, you have to go even more above and beyond in pediatrics because you're taking care of a whole family. Oncology, people with cancer. Similar vibe to Med-Surg. You have a higher patient ratio, 5 to 6, and you're going to be passing chemotherapy. You can have patients who are immunosuppressed, so you have to do contact precaution, which means I'm throwing on my big plastic trash bag and throwing my mask on and my cap and everything. Or bone marrow transplant patients who are very sensitive to germs and everything. Telemetry or step down. Telemetry or step down is kind of like an in-between of med-surg and critical care. your patients on telemetry, which means they have a bunch of stickers to monitor the electrical rhythm of their heart. They can even be on drips in telemetry or step down. I've seen heparin drips as blood thinners to treat people who've had a STEMI, which is a heart attack. Insulin drips, God forbid an insulin drip, you have to check it every hour. Cardizem, which is a calcium channel blocker. Dopamine drips. And the thing with the drips and the step down telemetry, usually they're a straight rate, which means you're not going up and down. And if you need to, you're paging the doctor. You don't have the authority to titrate the drip. Titrate is fancy for going up and down on whatever IV medication they're receiving. But telemetry and step down, you're going to see typically 4 to 5 as your patient ratio. 4 is like an ideal number. 5 is like you're kind of doing more work. The cool thing about telemetry compared to Med-Surg is you're able to monitor their heart rhythm and their respiration rates and all that good stuff. So you're able to kind of keep an eye on them even when you're not in the room. So if they're flatlining or there's an emergency, you can see it in the telemetry box. Typically a room where somebody's watching a monitor to watch everybody's heart rhythms and see that everything's going okay. And last but not least for our inpatient setting, we've got psych nursing. Psych nursing is interesting. It's usually 1 nurse to 5 to 10 patients from what I've seen. You're going to pass out pills and you're going to be charting. And you'll typically have some jacked giant orderlies to help keep the patients in line. And you'll also have LVNs or LPNs, licensed vocational nurses, to help you out with taking care of the patients in psych. You definitely have to be a special breed of person to handle patients in the psych facility. But yeah, so that's going to wrap up talking about bedside or in-hospital jobs available to you as a new graduate nurse. If you found this video helpful, leave it a like. And if you want me to go more in depth on any of these particular specialties or want me to interview somebody, I'd be more than happy to. If you know somebody who I could interview, I'd love to interview to get to know more in depth on what it's like to work in these care environments. Yeah, if there's something else you'd like me to see and make content on, leave a comment. And we'll be going to part 2. That'll be releasing in the next couple of days on outside hospital jobs. But I hope you found some value in this video. This is Pierre LaFour signing off with the New Nurse Guidebook. Thank you, and I'll see you in the next one.